So good evening, everyone. My name is Christine Saunier. I am, in my day job, the Nova Scotia Director of the Canadian Centre for Policy Alternatives. And I'm here tonight as a member of the Steering Committee of Childcare Now Nova Scotia. I would like to start by respectfully acknowledging that the lands on which most of us gather are the ancestral and unceded territory of the Mi'kmaq. And of course, all of us are gathering on ancestral and unceded homelands of many peoples. And if you'd like to share in the chat, if you are on different unceded land, please do so. We recognize, in fact, that all First Peoples were here before us, those who live with us now and the 7 generations to come. As First Peoples have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all. And we commit to remembering that we are all treaty people. Why am I, as a settler, of course, acknowledging the land? To recognize the land is an expression of gratitude and appreciation to those whose territory I reside on. It is a way of honoring the Indigenous people who have been living and working on the land from time immemorial. It is important to understand the long-standing history that has brought us here to reside on the land and to seek to understand our place within that history. Land acknowledgements do not exist in a past tense or historical context. Colonialism is a current, ongoing process, and we need to build our mindfulness of our present participation. We are, of course, at a critical juncture. Tonight we'll be talking about childcare, and we cannot talk about childcare without talking about childcare and truth and reconciliation as we do this land acknowledgement. This most recent discovery of 215 and other precious lives lost, and of course that's the most recent discovery, isn't the first, and it won't be the last time that we have to face what has happened in the residential school system, the legacy of the residential school system of discarded lives, personal and generational effects of deep trauma in those who survived a government and religious institution designed to assimilate. In the Truth and Reconciliation recommendations, point 12 is that we call upon the federal, provincial, territorial, and Aboriginal governments to develop culturally appropriate early childhood education programs for Aboriginal families. We can help affect this as Childcare Now Nova Scotia. So welcome everyone to what is the first event of Childcare Now Nova Scotia, which had its foundational meeting on June 12th. As I said, I am a member of the steering committee, and we do have other members of the steering committee. And instead of missing people, I'm just going to name our steering committee. Here are the names: Adriana McKinnon, Audrey Bowen, Michelle Lowens, I definitely see you, Stacey Nadeau, Selena Lake, Rhonda Doyle LeBlanc, Jody McPherson, Elizabeth Conrad, Laura Fisher, Lisa Gentile, Karen Foster Jorgensen, Heather Cameron, Karen Wright, Don Learning, Margot Nickerson, and Naomi Stewart. Thank you for stepping up and volunteering as we do the work of the governance and other issues. And as we jump into really getting to a place where we have realized the vision of Childcare Now Nova Scotia. So Childcare Now Nova Scotia is a provincial coalition that advocates for a universal, comprehensive, publicly funded, high quality, affordable, accessible, accountable, and non-profit early learning and childcare system in Nova Scotia. And we are at a point where we understand and we know that the Nova Scotia government is currently negotiating with the federal government a bilateral agreement where there's real money on the table and real opportunity to see that vision come to fruition. So I'm so pleased that we are kicking this off tonight with this event, which we've titled The Caring Economy, Centering Childcare. And we will begin with 2 esteemed panelists who will kick us off this evening. First, Angella MacEwen. Angela is a senior economist at CUPE National, the Canadian Union of Public Employees. She's a policy fellow with the Broadbent Institute. Her primary focus is understanding the impacts of Canadian social and economic policy on workers. Angela writes a quarterly publication, Economy at Work, which aims to communicate current economic issues to a broad audience. She holds an MA in economics from Dalhousie University. And of course, she is also a research associate with the CCPA in Nova Scotia and did work with us, including our first cost of poverty report. Great to see you, Angela. And Elle Jones. Elle Jones is a two-time national spoken word champion and the former Poet Laureate of Halifax. She is dedicated to using poetry in prison outreach and youth engagement, and also does work with Centerline Studios. She's written for the Halifax Examiner. I know she's currently in charge of or heading the committee for defunding the police through the Police Commission in Halifax. And of course, so many other things. I know that one of her books, Live from the African Resistance, was published by Fernwood in 2014. I know there's many other things that we could say about Elle. I'm so pleased that you are with us tonight. We're gonna kick off with Angella MacEwen, please.
Thank you, Christine, and thanks for inviting me to be here. Definitely the Nova Scotia CCPA is kind of home for me. It's where I got my start being an activist. So I'm very grateful to all the work that comes out of your office, Christine, and that the activism in Halifax, which is fantastic. I always get to talk about the boring part of childcare. I don't particularly like making the economic argument because I think it should be enough that to say that we need it, that it's good for communities, that it's good for children, that it's good for parents. But on top of all that, it's actually quite good for the economy. If we're thinking about how to build prosperous economies, how to build sustainable economies, one thing that would help everyone, that helps level playing fields, it helps make sure that women have good jobs and can afford to go back to work after having children. It's the biggest job creator for governments putting money into social infrastructure. It has the highest impact. And so this is what we call a multiplier effect. So for every $1 million that the government of Nova Scotia would invest in childcare, early learning and childcare, it creates approximately 21 jobs in Nova Scotia. And so the reason for this, a lot of that is early childhood educators themselves, but then there are spin-offs because those early childhood educators spend the money that they've earned in their communities. That's called, that's what we call the induced effect. So when you have money in your pocket, as a worker, you're more likely to spend it in your local community, and that helps support local businesses and other local economic activity. But the other part is what we call supply chain, and so that's the indirect. So those child care centers would source the food that they're eating, perhaps locally they'd source the supplies for children. And so that creates additional jobs in the community. And then it enables parents to go to work. And so it has a pretty big economic impact. And what we found, we have what we call a natural experiment in Canada, where Quebec has done this already, right? Quebec has invested in early childhood education. And what we saw was that it more than paid for itself. So the provincial government put money into childcare, and that created the jobs of early childhood educators. It allowed women to go back to work and earn money. And so that increased income tax revenue from those jobs that were created, the increased economic activity. So that creates more GST revenue. It creates more, it grows the economy and the things that we measure in the economy. And so that actually returns more money to the provincial government than they spend, and it returns money to the federal government, and they didn't even put any money into it. So it makes sense for the federal government to have a role and to put money into childcare because they actually directly benefit from the increased income tax revenue of those jobs that get created. So it has a stimulative effect both for the province and for the federal government. And there's long-term benefits for women for their pensions when they're seniors. So we know that if we have a good, strong workforce development plan for early childhood educator workers, if we have a good plan in terms of making sure that those jobs are well paid, that they're unionized, that they have benefits, then those workers have better pensions. And that helps to reduce the inequality that we see between men and women, between racialized groups and non-racialized groups in their pensions, because there was just a report out in Ontario around this showing that pay equity issues take on a second life in people's retirements, and that there's a huge gap on the pension side. And so making sure that jobs that are primarily women's jobs, that are primarily racialized women in a lot of areas, that those are good, strong, well-paid jobs, that they have the respect and the support that they deserve, that has an impact, a lifelong impact for those workers as well. And so we need to see this whole package in place, the support for the children, the support for the parents, and the support for the workers. The plan that the Liberals have put forward in the budget supports a significant amount of money for the provinces to get started, but they haven't started talking about the workforce development plan yet. And that's something that Quebec didn't get started on right away either. And they had a pretty big problem trying to get enough workers in place to be able to expand the spaces that they needed. So if we look at how many spaces there are for children in registered spots, it's less than half of the number of children that need childcare. It's quite significant, the expansion that we're going to need in this workforce. And so we're going to need to start to have a training plan, and we're going to need to start to have a plan to make sure that these are good jobs for workers, because too often these workers don't get the wages that they deserve for the quality and the importance of the work that they do. So that will be important. And when care workers hear the government talking about making sure that the price is low, what they hear is that that low price for the parent is going to come out of their paycheck, that's on their back. And so we need a government to be talking about fairness for the workers as well as for the parents, because we know that we're both, right? We are both workers and parents. And so we all need to think about how that affects different communities. And I'm really excited, Christine, that you talked about reconciliation in how we're designing this and how we're thinking about this. We need to make sure that all communities are at the table, because what works for white middle class women is not the same as what's going to work for other communities, especially communities that have very specific negative historical relationships with state institutions, right? So that in order for there to be culturally sensitive and appropriate care provided, people who are affected by that need to be at the table for designing it and for talking about it and for thinking about it. And there's no way around that. That has to happen in order for it to be effective. Too often when we're rushing to get stuff done, the loudest voices are heard, and the loudest voices tend to look like me. And so we get something that doesn't work for everybody in the community. And again, that's what the experience in Quebec taught us. There were small not-for-profit centers in white middle class communities, but in other communities, there were big box stores or there weren't spaces. And so the high quality childcare didn't end up being put in place in the areas that needed it. It wasn't culturally appropriate. It wasn't thoughtful about the needs of the communities where it was going, unless the people had the resources to make it responsive to their needs. So I think I think it's great news that you've started doing this work already, because that's so important. And I think I'll leave it there.
That's fantastic, Angela. I'm just going to underline a few things because I've seen your analysis and we're super excited that you did the analysis, Angela. We are excited to have the numbers. You know, we always need to hold the government's feet to the fire and ensure they actually follow through. And so you said $1 million invested in early childhood education would result in 21 jobs. I know you've also done the GDP multiplier. So for every dollar, it's what, $1.23 in GDP multiplication, which is also fantastic, especially when you compare that to tax cuts, right?
Tax cuts are the worst. Tax cuts have the lowest multiplier of any government spending. And childcare is one of the highest multiplier of any government spending. And it makes sense if you think about it, because it's centered in the community. What happens is the work that women do isn't counted in GDP. So that GDP is happening now, they're just not counting it. And so when the state, when the public as a whole covers the cost of it, that is merely bringing that work into what we're counting as GDP, because we know that this work is happening, we're just not counting it. And so it all goes back to Marilyn Waring, what if women counted? And so implementing affordable nonprofit public childcare is simply counting the work that women do as valuable.
Thanks for going there, Angela, because I think that's a good segue for Elle, and that is, you know, not only do we not count in the economic measurement ways that this caring that happens in community, but we undervalue it, we take it for granted. It's often unpaid, and even when we pay it, it's underpaid. So I think it's a good segue into thinking about a society where we actually value that work. And I'm not to say that GDP is the way that we should value it, but currently, of course, GDP values anything in the economy, whether it's destructive or not. So I think maybe that's a good segue for Elle to share her thoughts on the caring economy, caring society, however you want to frame that. I'll hand it over to you, Elle.
Thank you very much, Christine, and thank you, Angela. I'm going to open with a poem that I actually wrote for CUPE, so I see Nan here, so you're getting a CUPE original, and then I'm going to make some remarks after that. Somebody died at home last week because they were afraid they couldn't pay the ambulance fee. And there were those who said it's necessary in case people call frivolously, my God, in a rich country. Nurses going on shift without money to pay for the childcare they need because school's closed. But it gets worse. Construction workers scared to turn down the job even though they know that infection risk at job sites grow. Still haven't vaccinated the teachers, no. Grocery store clerks, essential workers, but wages stay low. Infection ripped through the long-term care homes, and the city pays for cops to evict tent city in the snow. And out on the streets, people continue to overdose. How can this be so? The news reports the multinational corps continue to see their stock price rise. Jeff Bezos gets another few billion while postal workers downsized. Have to pee in a bottle just to meet your deadlines. That's what happens when the economy's privatized. There's infection on the bus lines because people can't afford to drive. The only Ford most people have is Doug, who sent infection sky high. All those policies passed to protect the bottom line. All those unions busted with benefits in decline. All those pensions, all that healthcare taken by design. All those cleaners, all those carers barely can survive. And all along the powerful say, as long as I get mine, as long as all my friends also have their pockets lined. And now there's folks dying in the hallways of the hospitals, and that should be a crime. But this isn't the product of just 1 year or 5. Without decades of austerity, more folks would be alive. This is a symptom of society deliberately deprived because public services save lives. Let me say this simple, in case it's academic. What we're living now is what we call systemic, and poverty and cruelty, another epidemic. Racism, prisons, we're living that pandemic, and this is caused by politicians staying apathetic, so you can't afford a paramedic or medicine for diabetics, and that efficient global supply chain leaves us out of anesthetic, and they were so energetic, saying workers were pathetic, full-time workers needing food stamps, and we're forced to live off credit. Let me talk about the woman in most of the caring professions. What about the migrant workers who don't even have protection, working on the front line and still their class is second, picking all our produce and sent back without injections, and in case I didn't say it, inequality is gendered. Working women around the globe who barely are remembered. There's no support for mothers whose labor stays unseen. Single moms working double now on hour 15, and women around the world in sweatshops making $7 a week. And there's reserves in Canada where the water still ain't clean. Well, I think that it's obscene. Why should pharma companies make profit for vaccines? Why should first world countries be prioritized? Surely people are more precious than profit at any price, and we only will be safe with what corporations can't provide. It's folks within our neighborhoods bringing each other supplies. And we invest in the collective, then everybody thrives because public services save lives. So though there's no politicians watching, let me give you my advice. We know how all your rhetoric just rules and divides, and we're tired of this cruelty delivered in disguise. And when we once again can gather, you can bet we'll organize, because our health and safety is not something you can buy. And we want to see free transit that everyone can ride. No more evictions kicking tenants to curbside. We want universal housing and a living income for you and I. We want libraries and public toilets and safe injection sites, few tuition and student debt excise, green spaces to exercise, care for every child, no more neighborhoods gentrified. We want clean air and water and respect Indigenous rights. We don't want more money into prisons or giving homeless people fines. We want our seniors taken care of once they have retired. And we want all our spaces accessibly designed, status for all, green energy. These things will be our guide. And no more of these conditions where Black folk are first to die. We're going to be the boats that are lifted by the tide, and we sing, which side are you on? Because we choose the human side. We will always choose a world that sets nobody aside, because public services save lives. So let me say it one time again for the people up on high: public services save lives. Thank you, everybody. I messed that up because I'm super tired. Okay. I just wanted to say a few things. Like Angela, I don't think I'm going to take 15 minutes. What I was thinking of, and I guess I talked about tent cities in that poem that I didn't realize until I read it. And then I was going to open my remarks by talking about the resources devoted in Toronto. And yesterday, I believe it was, time moves so fast, yesterday, where we saw, hundreds of police, helicopters, all of this, just to simply evict people living in tents, to evict people from their housing and belongings. And of course, that eviction was successful. So we know that our governments have money to spend when it comes to destroying the belongings of houseless people and making sure that they have nowhere to stay. But yet we have seen not only, of course, workers, but our future essentially mortgaged for decades under this idea of debt. And I wanted to think about the role of the child within colonial capitalism, which always claims to center the child in particular ways, right? We have all these narratives about takes a village, oh, the child, the child, the child. Yet in practice, of course, our treatment of children, and not just currently, but going back quite a few years, way back, like back centuries, is very much based upon cruelty to children and the elimination of children. So, and of course, we can think of this in the context of Canada, where, of course, the 215 bodies of children were uncovered in residential schools. We know Indigenous people for decades have been telling us this is the case. We have many testimonies of murdered children. And so we can think about that as the fundamental disregard, not only of the Indigenous life, but of children's lives, that this country is, of course, being founded of, a country where residential schools were one of the prime methods for eliminating and committing genocide upon Indigenous people, not just cultural genocide, of course, but genocide, period. And of course, a large vehicle of genocide is, of course, I keep saying, of course, is to attack the children, to eliminate children, to separate children from their parents. So we know that capitalism understands the importance of the child when it comes to attacking the children of Indigenous people or of Black people or of people living in poverty, yet at the same time maintains narratives of childhood innocence when convenient, of course. So when children want to be held up in particular ways, then it holds up a particular narrative of capitalism. So what I'm saying here is that none of this is an accident, right? As we're like, but how can we do this? They're innocent little children. This is in fact a mechanism that has existed for centuries. We can go back into the Victorian period, of course, which is where a lot of our narratives of hearth and home and the nuclear family and the importance of mothering come from. The Victorians, of course, created a lot of this discourse. At the same time, of course, we had rampant child labor. And you can look at testimony from Halifax, for example, where there's this like guy that once came to Halifax and was like, oh, Halifax is so great because even like the 2-year-olds are laboring. Like you can see them like toddling along the docks doing work, you know, so that coexisted with the same time as the rising narrative about particularly the innocence of white children, right? And then that narrative around children was very much exported into the colonies, where there was a mixed idea of colonial peoples, both as savages, but as children, right? So the famous Rudyard Kipling line, which is half savage and half child, right? Your new caught sullen peoples, half savage and half child. And of course, what that line indicates to us is if you treat the colonies that way as children, how do you treat your own children, and vice versa? And we know, of course, that British children at that time were being subjected to boarding schools where we now know that was mass abuse, mass rape, many of the same practices that then got exported upon colonial peoples in schools that were then run by missionaries, which were then called care, right? So the residential school was phrased as care. Dr. Val Johnson at SMU has done a lot of work on how white women in residential schools really saw themselves as like loving the children, would talk about, you know, this is like my baby, I love this child, as they beat the children, as they starved the children, as they separated the children from their families, and saw no disconnect between those actions and their professed care, and really believed they were caring. And so this is what I'm trying to suggest, is that care in our economy, in our society, it's not new, it's not just a function of neoliberalism, it is long embedded within capitalism, that care for children, care for the poor, care for etc. is always bounded by cruelty and has always been bounded by disposability. And that hasn't been separate from children, even as we've developed these narratives around like child innocence, child value, center the children, listen to the children, etc. As was already brought up, of course, we outsource most of our childcare, lots of our childcare to nannies, to particularly brown and Black nannies from across the world. Of course, the first immigration from non-white people into Canada that was accepted before we changed the point system, when we started bringing in like Black immigrants, was to serve as nannies and domestics, right? To like do the home care. Obviously, enslavement, Black women breastfed children, cared for the children, mammied the children and families. And as many people have pointed out, you nannied a child that then grew up to call you the N-word, right? So there's always been also this embedded kind of outsourcing by the elite of their childcare. We know that one of the sort of failures of the feminist movement has always been that we were not able to secure universal childcare, and that in many ways abandoned the notion of universal childcare in favor of policies that would benefit more wealthy and privileged women, including our domestic worker programs, which allow wealthy women to bring in childcare, but of course do not allow women who are poorer, who do not have those advantages, to have free or at least affordable childcare. And so the child, again, is a kind of ground for this class battling, for this, like, for these colonial acts. So Angela already brought this up, but, you know, a lot, yeah, that we cannot separate the lack of childcare from then our abusive migrant workers, many of whom are on the front lines. And the fact that, you know, a nanny can come in, live in your house, be stripped of her papers, vulnerable to abuse, sexual assault, and has no power because her employer holds all of her papers. And we see this not only in Canada, but around the world, where women from the Philippines, from Mexico, from Jamaica, from Ethiopia are around the world serving in these childcare roles, not able to care for their own children, sometimes without a path to citizenship, and then so vulnerable in this system. And that's what we have largely chosen instead of investing in proper childcare, instead of investing also, as was also said, in women's labor, a job, of course, often done by women that come from lower income backgrounds, women that come from less privileged backgrounds, and that childcare can allow a path to some kind of economic sufficiency. So this is also, again, class, that not only in that, you know, who needs childcare the most and who can't afford it, but also in, it's not just that women are doing early childhood education and daycare work, it's that it's also often women from lower income families that end up in that work and do not receive the same kind of benefits as women from in more so-called professional middle class jobs get, even though you're doing an extremely difficult job that we claim to value because we value children, but then don't actually value. I have a note here about satanic panic in daycare, which I think I'm just obsessed with. I think when I was going with that, yeah, I make these notes and I don't know what I mean. The next note, it says child separation, it says satanic panic. But I think where I was going with that was the backlash to, and the fears that we've always had of childcare as well. That one of the reasons why we haven't invested in childcare is feminist backlash, right? The notion that women actually don't deserve to be working outside of the home, and we should actually be caring for our children. And there's something dysfunctional or wrong with women who want a child in care. And we saw that reflected in the satanic panic in the 80s in particular around daycares, right? Which, as all moral panics, wasn't about the thing itself, but was about reacting to something else. And that we can put in the context of the fears around women working and the fears of, putting your child in the hands of somebody else. And this manifests in satanic panic. So what I'm just saying here and raising that is that we continue to have, I think, a disgust and disdain for women that aren't caring for their children 24/7, right? And these notions of motherhood continue to impact all women, this ideal motherhood. And Indigenous women are, of course, never ideal mothers. And that's why we see like birth alerts in hospitals in Winnipeg where social workers are taking babies off breasts. Black women are never seen as, we're always inherently unfit mothers from the time of slavery, where our children have been taken from us, continue to be taken into the child welfare system, just like Indigenous kids. But also backlash to middle class and educated women for not having children soon enough, for not having enough children, and then for being, such slovenly mothers as to want to put your child out for childcare. So part of the disenfranchising of childcare has been a moral issue. It's not simply about economics. It's about the moral belief that if women were real nurturers and real mothers, we would just somehow be like, have our children on our bodies like 24/7, and we wouldn't be going out for work. So we can't separate, in other words, sexism, and this has already been said as well, we cannot separate sexism and anti-mothering and pure mothering ideologies from this. I was going to say, the last thing I'll say here is that our sort of fetishization of the child in these ways where we never actually care for children has a lot to do also with like this idea that industrialization and capitalism puts into us of the sense of loss. People have talked about this in terms of like the white identity as well. Stick with me here. So the idea is that, whiteness becomes this industrial identity, and then you always feel lost for the things that you feel you've given up by becoming civilized, right? So then it's like, oh, Indigenous people are so great. They're so close to nature. Black people have so much rhythm. Like if only, so you give something up. And this is part of our like innocence and childhood nostalgia idea, right? As we become more stressed and we become, adult life becomes ever more tedious, ever more like tapped out. We're dealing with stress and depression, anxiety. We elevate the child at the same time. And we're like, oh, I just long to go back to childhood. And this is kind of a symptom of like capitalism, industrialization, that we're in a permanent state of nostalgia for what we have lost, but like also feel that we are better because we are the people that gave that up. Like we're not like those primitive people that don't have jobs. Like we work, but then we also have this kind of ongoing like disgust and desire towards these things. So where I was going with that is this idea like that, again, the part of the reason why childcare is not funded is that, we're in a really like, we have a fraught relationship with all of this. So we both, want to hold up childhood innocence and love the child and care for the child, but we can't come to terms with it because we live in a society that actually doesn't allow children to be children, that actually wants people out working, that wants youth out working, that, wants us not to mother our children, that doesn't actually provide us the resources to care for each other, and that is an anti-care society and has always been an anti-care society. Whether that's our defunding of schools, right? And somebody said, we had the defunding public engagements on Saturday. And as somebody said, you act like defunding the police is so radical, but you've been defunding education for years. Like nobody blinks when we defund childcare. We're like, what a crisis. And then somebody's like, let's take $500,000 away from the police. And it's like, oh, society will collapse, So we continue to not value care because we live in a careless society. So it is important not only to push the government, but to rejig ourselves and to think about what it means in terms of to truly live in a caring society. I've given this sort of like capsule. I was sort of jumped through history. Like that was a very quick history. Don't take that as like the dissertation of the history of the child. But the reason why I was raising it in this context is because at this juncture, when we talk about COVID, when we talk about the fact that we are living through, the late stages of capitalism, that we are living openly the complete failure of this system, we actually also have the opportunity to build other things. And we have seen some of that through COVID, whether like Halifax Mutual Aid, like out here building shelters for people and defending those who are homeless. There's been a lot of more work on decriminalization of drugs and people understanding that, we need safe injection sites and we actually need to care for people with addictions and not just discard people. That, prisons and punishment punishment don't work. And we actually need to invest in healing and treatment and mental health, and that we cannot continue to just discard of people. And of course, childcare is part of that. And again, the child is a bit different in that, unlike people who are homeless or drug addicted or like in prisons, we don't blame the child. They get to be innocent, yet we still don't care for them, which is part of what shows us that this entire society is incapable of care. You cannot have profit and the kind of care that makes sure that a child is nurtured from birth. You cannot have profit and the kind of society that understands that mothers should be able to choose to work or to not work and have their child be safe no matter what. That we can invest the kind of money we invest in policing, we could be investing not in the bare minimum of childcare, but in beautiful childcare, and children being in nurtured spaces, being able to grow things and be out in the world and touch things, and not just like, let's line you all up and make sure you're being obedient because we have one childcare worker that has to take care of like a maximum amount of children. We can do all these things, but it's not just a case of even one policy or like one moment with the government. It requires us to rethink these kind of ideologies, the ideology that says that there's only so much to go around, the ideology that values punishment and policing and disposability and hatred over care for each other. And one of the things I think we have seen coming out of COVID, we've seen the worst of that. We've absolutely seen the selfishness, the cruelty, the corporate profit, and we've also seen our own ability to build something different. So as we progress in fighting for a caring economy, that means, as Mariam Kaba says, everything must change. And we have the ability to change everything, beginning with how we care for each other, beginning with how we constitute our families and our neighborhoods and communities, beginning with the fact that other mothering is a reality, that many of us come from cultures where mothering is shared among people, and that we understand that as sacred roles, and not only for women. Like, let's not be like cis-centric here. There are mothers and parents of many gender identities as well. So I guess I'll stop there. I don't really have anything else to say, but I guess I'll just say that like, it is past time for us to rethink care, and to rethink care, like, we tend to invest in care as a pretext for discipline or authority or obedience or containment. And what we need is actual care. And that care that leaves none of us behind, and particularly does not leave our children behind, even as we talk about children are the future, and then make sure that children have no future at all. So I will also stop there and leave it up for discussion.